and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
Ocala's information station, 1370 WOCA. Ocala!
I got a good job. I get hugs. People come into the studio, I get hugs. All right, this afternoon, I'm going to get an ablation. I didn't even know what that word meant a few months ago, and in my case, I get them in my leg. I didn't even know you could get them somewhere else. I just learned something right now, and I learned it from Dr. Ranjit Gowda, who is also Jeff Goldblum's younger brother, by the way. And Dr. Gowda has been in with us before. He is the guest of our friends Lauren Devick and Leah Caruso. Lauren is with Ocala Health, and Leah is, of course, with Strive Rehabilitation. And we're going to talk about radio frequency ablations. I couldn't tell you if that's what I'm getting. I don't really know. I've had two of them so far, but anyway, I'm going to have a third one today. Dr. Ranjit Gowda is a board-certified physical medicine and rehabilitation doctor, board-certified and fellowship-trained in interventional pain management, and he leads the Strive Rehabilitation multi-specialty team of experts. So good morning to all of you. Good morning, Doctor and Lauren and Leah. Good morning, everybody.
Thank you for having us.
And so I told you off there I'm going to have one this afternoon, and then I realized it's what I'm having is not the same thing you do. It's got the same word, though, right? Ablation?
Yes, radio frequency. It's the technique or the physics of it remains the same, but radio frequency being used for different structures or for different purposes. And we can, what radio frequency involves is a method or a technique of introducing localized heat to body structures so that that particular structure that we want treated can be deactivated, or as you mentioned in your case, the vein can be treated. And so can little tiny tumors in the liver, heart.
Oh, really?
Yes.
Oh, wow.
And or any particular nerve that we want to deactivate. And the case in what I do would be different from the vein ablation that you would be getting is being done in the spine for arthritis and back pain.
So what generates the heat? Is it microwaves or?
The heat is generated by, it's especially designed, for example, I'm going to talk in regards to the back. It's a needle which is mostly insulated, except for at the very tip, it's a tiny metal part that we would see in any needle. It's exposed, and heat is generated by a machine called radio frequency generator. It sends electrical signals, and these signals happen to be in the general frequency that radio waves are classified.
Like what we're talking on right now.
Right. Okay. And this would, for example,
I could just stand in front of my radio. My leg would get better.
Yes, right? If you increase the energy level up, that could happen. Radio waves, I think, for example, this is not AM, this is FM, of course.
Well, we got both.
Yeah.
I don't know if that helps.
But in FM, the problem becomes the frequency itself is modulated. But in AM, they have a standard set frequency, usually around 550 kilohertz, or general radio transmission.
You know more about radio than I do.
He knows a lot about everything.
Well, it's just physics.
He does.
So this one, the radio frequency generators that would be used for anything in the body generally have a frequency range somewhere in the 250 to 550 kilohertz range. So this use that electrical energy because it's a little bit, it's better controlled and it's lower heat.
So that's what generates the heat. What prevents it from going where it shouldn't go? What prevents it from going far away? Like if you're working on a little tiny thing, like radio frequencies in this radio go everywhere. You can.
That's true. Yeah, and you're in very good question, because the whole thing about the specially designed catheters or needle tips is with the purpose that the energy is localized around the needle tip. There's a ground patch that is put somewhere else in the body, and it's precisely defined and controlled for no greater than 0.5 to 10 millimeters around the needle tip is where the heat
Really?
is, because the rest, so it concentrates just like an antenna would concentrate the radio wave. So it concentrates at that spot, but where it's diffuse, it would be just a plain radio wave without any heat. So
When you treat the patients, if it wasn't for you and this procedure, would they have had to have an operation before
yeah,
this?
that is true. That's why it's called rhizotomy, though a lot of operations weren't necessarily done for this. It was was a great idea to cut the nerves, so to speak, and so in the back we call it radio frequency ablation, or another word for this procedure is radio frequency rhizotomy of the medial branch in the back. What it is a small branch of the main nerve in the back, so a lot of people are concerned that this could be my nerves are going to be burned, and I don't want that.
Yeah.
No, this is just a small branch of the main nerve that carries the pain signals from the joints in the back, where most of the back pain originates in most people. Is we call them facet joints medically, and these joints have nerve endings that carry the pain signals. So in an arthritic joint, the pain signals would be transmitted through the small branches that then pass on the signals to the main spinal cord, and we recognize my back hurts. So
we're always warned that if we take painkillers, that we're not really solving the problem. We're just making it easier to handle the symptom. That sounds like not exactly what this does. What you do, it sounds like you get rid of the symptom, but there's still a problem. But what the problem isn't important, or
well, the back. We talked about this in prior radio shows, and I don't expect anybody to remember, but the back primarily has vertebrae as we all know it, and the vertebrae stack up on each other and move in relation to each other. So when we say my back is stiff, or my back goes out, or my back is aching, we really mean the joints in the back that are necessary for back's mobility and flexibility, as would be any other joint in the body. When they are arthritic in the back, unfortunately for the spinal joints, there isn't an option such as joint replacement as we would know for a hip or a knee. So we would have when an arthritic back moves, it generates a lot of pain and discomfort, which further makes the muscle spasm and tighten up even more, causing even greater pain and discomfort. So we hope to break this pain cycle of rubbing joints causing pain discomfort by eliminating the pain discomfort signals being sent up.
And do you help all ages, or is there a
this is
separate age group that you help?
I help all ages. I mean, but typical radio frequency is something we would look at most times in the middle or later ages, because it's not something children generally need spinal treatment with radio frequency. I mean,
so today, when I go for my ablation, can I just prank my doctor and say, is this supposed to happen? I'm hearing a radio signal. Can I tell him I'm hearing WOCA right now?
Yeah, I think you would definitely make his eyes roll for I'm hearing.
Is this supposed to happen? I'm hearing something. I'm hearing.
Well, that's because you work at the radio station. You can tell them you're here 96.3.
So if somebody's in a car accident, and I know that at Strive you work with rehabilitation, right?
Absolutely.
So somebody's in an accident and they're going through rehabilitation. At what point do you say we need to do this procedure because rehabilitation needs another step beyond what they normally would do?
This procedure, the indications is what you're alluding to, is generally for back that we have for sure determined that it comes from the joints in the back, and this is usually done by 2 prior injections that would have been done in the back in most people. So if somebody with back pain comes in, we call the very same nerve endings we intend to deaden, we would just block them. And then the critical element there is that someone who's suffering from this back pain obtains a definite relief from those, just a local anesthetic injection that proves that most of their pain and discomfort is indeed coming from those nerve endings we intend. At that point, it's a positive confirmation that they have relief from the nerve endings being just blocked with an anesthetic, which would indicate by deadening or burning them, they would potentially get this benefit for longer term, which is ideally 9 months or longer.
That's enough time to have a baby.
We'll thought of it that way.
We'll take a little break and we'll be right back. If you have any questions, the number is 622-9622.
The weather is brought to you by myfwc.com. Safe boating is no accident. Partly sunny today, a thunderstorm inland this afternoon. High of 90 to 92, and a thunderstorm into the evening hours, then it clears back out tonight. Low 72 to 75. Tomorrow and Saturday are going to be partly sunny with inland thunderstorms in the afternoon hours. The high will range from 90 to 93 both days. From the Florida Weather Center, I'm meteorologist Maggie Johnson.
Hi, this is Brad. I want to take a moment to talk about a serious issue. In the next 5 years, the aviation industry is projected to have a shortage of commercial pilots. Now is the time to start training. Ocala Flying Club has started a scholarship for the youth of Marion County ages 17 to 24. The club will donate up to $4,000 towards a pilot's license. This will help get the student on their way to obtaining their commercial pilot license. If this sounds like something you would be interested in, or if you know someone that would be, please contact Ocala Aviation Services, 861-7484.
Palm Garden of Ocala leads in the area of orthopedic care with proven outcomes. Planning to have a new hip or knee joint due to arthritis or as the result of a fall? Palm Garden may be the answer. Guests appreciate the services of highly trained therapists and state-of-the-art equipment. And if you pre-register, you can secure a private room at no extra charge by mentioning this ad. Palm Garden makes no bones about it. They provide the best in orthopedic care. Call 854-6262. That's 854-6262.
You can't put it off any longer. It's time to replace your home's AC system.
The answer is ACEsolvesItAll.com and an exceptionally efficient AC system. Let the pros at ACE show you how you can save on energy monthly and give your family added comfort. The great thing is that ACEsolvesItAll.com is on call 7 to 7, 7 days a week at no extra charge.
For a limited time, mention WOCA and get a special discount.
Call 877-765-4ACE or ACEsolvesItAll.com.
Located next door to Silver Spring State Park and a few minutes from historic downtown Ocala, our award-winning Holiday Inn Express Hotel and Suites of Silver Springs is a place to stay for a friendly, memorable, and fun experience. Enjoy our fast and free Wi-Fi, complimentary hot breakfast, and free parking. Whether you're in town for work or play, our friendly staff will make you feel right at home. That's the Holiday Inn Express and Suites of Silver Springs, proud sponsor of Friday night Marion County High School football on WOCA, The Source.
All right, 17 minutes after 11 o'clock. Thank you for tuning in. Dr. Ranjit Gowda is here. He is the guest of Lauren Debick and Leah Caruso. Lauren is, of course, from Ocala Health, and Leah is from Strive Rehabilitation. And Dr. Gowda is talking about radio frequency ablation, and his specific application of this is with the back. And if you have any questions about how back pain can be alleviated with this procedure, feel free to call in. We would love to hear from you. Do you know the machine that my doctor uses? I'm getting this to not in my back, but I'm getting in my leg for those who care. But the machine sounds like my mother's old electric sewing machine. Like, yeah, I'm just laying there hoping to God that my underwear is clean, and he's got this thing going, and it sounds like my mother. You ever use an electric sewing machine where you step on that pedal?
Oh, yeah.
And that's what it sounds like. Does your machine sound the same way?
No, it doesn't.
No.
And I think there's a reason. This one's it's silent. We don't hear anything. It goes through. In the back, it's a little more precise because it's just a one tiny spot around the needle tip. We need the heat versus a vein, which is a long tract of vein, and so
especially
I'm
mine.
sure it's pulsing all along the way. But in this one, it's very quiet and the testing. Usually, it's all an outpatient procedure. People come in and need to plan for about an hour and a half at the most as an appointment time.
Yeah.
Usually no IVs involved, and come in, generally we would expect someone to come.
It's outpatient? It's an outpatient?
It's absolutely, 100% outpatient procedure. No sedation, no IV.
Wow.
If you see a person that's starting to have signs of that dowager's hump on the back, can you do a procedure like that to keep that hump from forming?
Radio frequency is not indicated for spinal deformity of what you mentioned about the Dowager's hump, and that tends to be more genetic and osteopenia and osteoporosis and postural related kind of change. Radiofrequency is more for arthritis or neck pain that's coming from our most common garden variety pain that usually is in the back. Generally happens to be, and we all hear about, I got arthritis in my back, and that's exactly what radiofrequency intends to treat. Years ago, there wasn't much of a choice, like you were mentioning, Larry, using medications or just using arthritic pills and posture and positioning, and not many choice of actually treating the joints from not rubbing against each other. So, but now it does. It isn't really about just putting a nerve out of action so the problem goes on. It does relax the muscles in between the spinal columns that cause the spasm. So, in a sense, it prevents the joints from rubbing on themselves more. So hopefully slows the disease progression over the years by helping the arthritis inside.
Our hope with these interviews is always the same, is that somebody listening will benefit from this. And we always remind the listeners that we do videotape these so you can share this with somebody else who might benefit from this. So really, what do we tell them? We say, if you know somebody with back pain, this might be for you. I mean, we can't diagnose ourselves, obviously.
Yeah. No, if somebody has back pain, and for one, if they're not tried any treatment or been or had it evaluated by their doctor, the first thing is you would address it with your regular doctor and say, do I need to see a back or a pain specialist? Or if you already had it addressed before, but radiofrequency was not one of the options back then, it could be something beyond just a plain cortisone injection, as most people understand, because this is something that is the most advanced and the latest available treatment. Right. Even though it's latest, it's been around for longer than 10 to 20 years at this point. So, but it still is the most advanced treatment and one of those definitive treatments that is available for arthritis of the back. So they could talk to their doctor or call and come to I'll have Leah give out the clinic number and address, for where we can reach us to get an appointment.
Yes, feel free to call Strive Pain and Spine Center at 352-690-7777.
When somebody has something, I don't know how to describe this, but I think Joe Martin was telling me he had a back issue and they were thinking about it, or they did, Robin, do you remember this? They injected something between the two pieces of the spine to kind of spread them apart. I think he described it as cement or something.
Right. Yeah, cement.
Yeah. Is that
vertebrae?
Is that irreversible? Like if you get that, can you still use this or?
No, it's not. That one is irreversible in itself because you put a cement for a collapsed vertebra. But this still could be an option for anybody because that is for back pain that's coming from a collapsed vertebral body or discs or more. It's the front of the spine, and the radiofrequency is done for problems arising for the back half of the spine, the joints.
So in our mind, to get a picture of what you're doing, it's a very, very tiny area, and you are basically killing it, right?
Right, and we use an X-ray to guide. These procedures are all done.
That's amazing that you can even know that it's there.
Yeah, and that's exactly why it became an option, because the nerve that goes to the back joints goes at one exact precise location in the back, and why it didn't become an option for other joints in the body, because the joints to a knee or a hip or shoulder, it's hard to locate where exactly they may be. It vary from person to person. However, back joints being very close to spine have this exact anatomic location where this nerve goes at, and that's how we can be 100% certain that we can kill it or deaden it. So.
Can you do the reverse? I mean, since you're affecting the nerves, because sometimes when people are born, they don't have any motor functions in the back, and then they have to sit in those special chairs to help them. Is research being done to do the reverse then on the nerves? Since you can help the pain that's attacking the nerves.
There's a lot of research being done, you're right, to help people regenerate their neural tissue, but this particular type of procedure as radio frequency wouldn't be of any benefit there.
Oh,
but even then, it is an option for, let's say, if somebody's born with a motor problem and they have spasticity of a particular muscle or a nerve, and radio frequency is indeed used in certain locations to deactivate nerve there because people can have deformities from a muscle that acts like cerebral palsy or spasticity, but that's not the typical use of it. But it is being tried. But you said what is out there as a new experimental approach.
Because you're wonderful. You could lead this whole thing.
Leah, you brought in a Dr. Andrew, a young guy. He was a chiropractor, right?
Yes.
So is that like step one? You go to a chiropractor, and then if that doesn't work, do you know what I mean? I was under the impression that the chiropractor is the least invasive thing you can do, and if that works, then you're fine.
Yeah, I mean, you bring up a very good point. Not everything that hurts in the back needs surgery or radio frequency ablation or anything further on down the road. A lot of times, and we all understand this, when we have back, we give it a few hours, it goes away, or a heat pack or a cold pack. We may not even go to a doctor's office or a chiropractor's office. But if something that stays on and it's severe enough, that's when we approach and seek some medical help. And I think at least 40% of Americans have a chiropractor that they approach for a back pain problem.
Yeah, I would imagine that's probably the first thing we think is
right.
Yeah.
It does. But if it's for what we're talking about here with back arthritis and radio frequencies, arthritis, if it's truly there, it's not going to go away, and it's something that we're going to live with ours and take it to our grave.
Right.
But all along, we will have problems. We might have back pain, and if there is an option of meaningfully treating it by, and this is it's not an option for every single person with every kind of back pain, and those with arthritis, if adjustments, treatment, physical therapy, posture, positioning, and even simple injections do not help much or do not help long enough, then before deciding that I have to live with this, there are treatment options out there that possibly we can be more active, and that's good for the cardiovascular health.
Does exercise actually help? Like you always hear this, if you get out and walk more, if you just, not necessarily heavy exercise, but just moving around, does that help?
Yeah, I mean, we have to move around because you at the old age adage, you keep what you
Why'd
use.
you look at me when you said
that? No, it's the age-old adage that you always have this aphorisms and sayings. So this looking at, you keep what you use, you lose what you don't use.
Oh no, I better start using things.
Did you say that it helps asthma too?
The radio frequency has been, when you said about all the experimental and different location, they've been using for, I don't use radio frequency for asthma, but in asthma research, they've been trying to use radio frequency ablation for the muscles in the respiratory passages that clamp down. In asthma, typically is the muscles clamping down. We all understand that. Despite all medications and everything, and very severe asthmatics, that there's still some additional need for the muscles to be treated. They have used radio frequency, but in a very different method, technique. It'll be done by a pulmonologist, and so.
The last couple of times I went, the doctor said to me, "What'd you talk on the radio about today?" He's never going to believe this. He's never going to believe this. And I wanted to ask you to repeat the phone numbers, if you could, so people could call Dr. Gowda.
Absolutely. Again, it's 352-690-7777.
I was thinking about the fact that you take arthritis to the grave, and Robin, I have a favor to ask of you. If I get arthritis and I die, since I'm taking it to the grave, would you please put on the headstone, "Here lies Larry and his arthritis"?
Yes, I will.
I don't want to leave it out. I want everybody to know it's down there with me. Dr. Ranjit Gowda, thank you so much for coming in here. Always good to see you. Give my regards to Mr. Goldblum and your older brother.
Thank you very much.
And we also have the Ocala Health Hotline.
Yes, absolutely. So for an additional physician referral or to have any of your health questions answered, we invite you to call us at 1-800-530-1188.
Lauren Debick, thank you.
Thank you.
Looking gorgeous as ever. And Leah Caruso, you too. Thank you for coming in here as always. And listeners, remember this interview has been recorded as a video. You can share it off of Facebook or YouTube. If you don't know where to go, the best thing I can tell you, just go to WOCA.com, and on the right-hand side down a little bit, there's a link to YouTube, and that's where all of our videos are. We'll be right back. Thank you.
Thank you.
Fox News Radio, I'm Anna Wells. 3 U.S. swimmers can't leave Brazil as cops investigate teammate Ryan Lochte's gunpoint robbery story.
2 of those swim team members